the JAMA Network.
For open heart surgery, no, that was not going to be done. And they said if I didn't get this done, I had, 2 to 4 years that I could live.
So Robert Pierce underwent a transcatheter aortic valve replacement like this one. A catheter inserted into the groin transports the new valve to the heart so it can be replaced without open heart surgery.
We wanted to make sure that the procedure was safe early on and effective then in the longer term.
Dr. David Holmes from the Mayo Clinic and co-authors reviewed the records of more than 12,000 patients who underwent this procedure and examined overall outcomes at 1 year. On average, patients were 84 years old and half were women. As a group, many of the patients had other heart problems along with poor lung and kidney function.
In this group of patients at 1 year, the mortality was 24%. Stroke occurred in about 4% of the patients at a year. If you were to look at that combined incidence of stroke and mortality at 1 year, was about 26–27%.
The study appears in JAMA, Journal of the American Medical Association.
The need for repeat hospitalizations appears to be decreased at 1 year in those patients that have these successful procedures. That's a good quality of life indicator, and that was better.
Overall, men in this group had a higher risk of death at 1 year. Women had a higher incidence of stroke. Advanced age was another risk factor for death.
We now have information as we talk with patients and as we talk with the regulatory agencies to say the quality of life is better. That's a terribly important metric that will be increasingly used.
Since the valve replacement, Robert's breathing has improved and he is no longer having chest pain.
I'm still on the right side of the grass, thanks to this.
Catherine Dolph, The JAMA Report.